Good evening to all of you on Facebook viewers across the India and also in the East Africa. I am Dr. Ankit Mehta. I am a consultant pediatric intensivist at Zydus Hospital, Ahmedabad. And what we are going to talk about today is everything about childhood fevers. So why we have chosen this topic is it is very relevant to the current scenario, and every mother or every parent gets panic as soon as the fever comes, and there are so many questions in your mind that what should we do, what should we not do, whether we should go to doctor immediately, and how do my child behave, is anything to worry. So there are so many things. So what we'll begin by is why we have chosen about fever, why fever is so important. So some of the common emergencies which we see at the Zydus hospital and even across India is fever. So around 3% of children reach emergency every day to have something related to fever. So fever becomes very important, and maximum outpatient department has fever as a chief complaint or sometimes as a other complaint. So fever, that's why becomes so relevant to the current scenario and to everyone, to us who have a baby or maybe who are grandfathers, grandparents. So that is the most important thing. So fever, why does fever comes? Is fever really an enemy? We are always worried, oh, fever aa gaya, what happened? Something is not good. So why do fever comes? So fever is a friend. First of all, it is the most important thing that all of you have to remember. Fever is a friend. Why fever is a friend? Because fever, as soon as the body temperature increases, the things which are happening in the body, like the viruses which are there in the body, or maybe the bacteria in the body, they do not get the time to multiply. So they cannot have more and more multiplication in your body. So their growth reduces, and that's why they control the infection in the body. So fever is very important, that once a fever happens, you have to understand that we have to identify the cause of fever. We are not looking at that, oh, we should bring down immediately fever, what has happened. We should know that what is the cause of fever, and the treatment of fever or the fever is that once is that we look what is the cause of fever, and the other thing is we make the baby comfortable during that period. You understand, as soon as the fever goes up, baby may become fussy, baby may become irritable, baby may start having flushing, baby may not look good to you, and that's why you get worried. So at that moment, the most important part is that you have to make your child comfortable during that period. And why the fever has happened? Because fever is a good friend of human body. So that is one of the thing, and these are all the things for the acute small things which are happening. I'm not talking about the fevers which have been going on for months. There the things are absolutely different, and there the things are taken in absolutely different perspective. What we here are talking are short small fevers in day-to-day life, and which are very relevant to all of us. So that is one thing which is there. So what number indicates fever? Another thing which comes to our mind is what number defines. So some of the parents come and tell us, oh, I've just tested his head and he is looking very warm. So is that a fever? So that is not the answer. So fever is always taken with the help of a thermometer. So what does it mean? Can there be something which can be closely looking like a fever, but it is not a fever? Yes, definitely. So there are certain things like an environment. If environment is very hot, you have covered your baby with so many things, like maybe he is in clothes which are very heavy, they are not light, and you have wrapped him up very heavily with some blankets. Sometimes even the head may be very warm in infants. So what is the cause of that? The cause is because the baby's brain receives lot of blood supply, and the baby's brain is having a lot of surface area in the body. What I mean is that the brain is a big part of the baby, like a baby who is under 1 year of age. That is called as infant. So most of the blood supply goes to the brain, and you may feel, yes, his head is always warm, but that is not fever. You have to check fever with the help of a thermometer. That is a normal process that may be happening in the baby. And other thing is, there may be some changes in the morning and the evening fever. Sometimes in the morning, the baby may be okay, and in evening you may feel, yes, he is a bit warm. So there are some variations which are naturally happening in the body. So there is variation of around 1 to 1.5 degrees centigrade daily, which can happen. So that is one of the most important thing for you to realize, that what is fever. I have to tell only fever once I measure it through thermometer. Then the next thing comes, how, where, how should I measure? So the other thing which comes is now that do we measure fever? So the most important thing for measuring fever is we should have a thermometer. So what are the thermometers which are available, that we will talk, but what are the common sites where we can measure fever as a parent? So the most commonly accessed site in the human body is axilla. So this is the common site where the temperature is taken in babies, because they may not allow you to take temperature orally. Oral temperature can be taken in the baby who is conveniently holding the thermometer below the tongue, and they can keep it below the tongue for a certain amount of time. So that may be very difficult. So that's why if you want to measure fever under 5 years of age, you should use a thermometer which is like an axillary thermometer. So do the thermometers are different for an axillary and oral? No, they are almost the same. The other sites where you can measure sometimes is, there are some infrared thermometers where you put the gun on this part of the human body, that is called as the temporal part, and where you can measure. Sometimes even you can measure in the ear. So there are thermometers which are available, and the other side which is available is the rectal side, that is the anal side. But it is very difficult for all of you to do that. So we don't advise routinely to monitor rectal temperature, because it is very, very difficult sometimes to do such kind of things at home. So the most common thing which I'll tell you is do a axillary, though it may not be very, very reliable, but if you monitor it frequently, it becomes very reliable. And the number comes to add something for the axillary fever, like a temperature in axilla may be 99, and then the doctor tells you, you please add +1, because it is in the axilla, we add something. We put it in the oral cavity, we add some +0.5. So I'll tell you, please don't remember all these numbers. The number which you have to remember is anything above 100.3 Fahrenheit. Any number which is above 100.3 Fahrenheit is defined as fever. Fine. So we are not remembering that what happens in the oral cavity, what happens in the axilla, what number should I chase, what number defines fever. For now, you remember that any fever which is above 100.3 Fahrenheit, that is defined as a fever. Now next thing comes, parents ask us, what kind of thermometers do we use? For us, we usually tell that please use a digital thermometer. Now the thermometers which were previously available, like the mercury thermometers, are usually not commonly used, because they are very difficult to use, and sometimes they may get break, and then there can be problems. The other thermometers which are available in the across the country are the infrared thermometers, which I indicated, that there is a gun like pointer which sends a infrared ray, and it is pointed till here, and then you get a fever number within around 5 to 10 seconds. But again, that is very non-reliable thing. And the other thing which is available is the tympanic thermometer. But usually you have to get trained in that, and it is quite very costly also. So what I'll suggest you is use a digital thermometer, which can be very helpful for you. So now the next thing comes, how should I take a temperature? Most of the babies are so fussy, they don't allow us. So the first thing is that the babies who are under 2 years of age, it may become very easy for you to take thermometer. First you have to take, suppose this is a baby, you have to take in the lap. Fine. First thing is that you take the baby in lap, you try to console him, and then you take your thermometer. Just for an example, take this. This is a thermometer, and I am trying to show you that how do you measure an axillary temperature. Just remember that this is a lap, and then you introduce. Do you introduce like this, or do you introduce like this, or should I introduce it like this? So you have to introduce parallel to the body, and the main aim is this tip should go into the axilla. Fine. So this is how you have to hold, and you have to keep till the thermometer beeps, because these are digital thermometers. They will beep, and then you take out and look at the number, and that's how you do it. So this is very, very relevant that you do it in a proper manner. Otherwise, your reading may be fallacious. Some of the thermometers may show a very abnormal number, like if you tell me like 107, 106, 108. So remember that there are hardly any fevers in day-to-day life which can reach around 107, 108. There are very, very uncommon reasons which are there which can cause such degree of high temperature like 106 degrees or 107 and 108. That be absolutely a medical emergency. And if you feel that you have rechecked and the baby is having fever more than 106, 7 or 8, it is definitely a medical emergency. You should immediately rush to a nearby emergency. So next thing comes, so okay sir, we have taken the temperature. So what next? If I take a temperature, what should I do at home? First thing what I do at home, should I take him to a bath? Should I pour him a cold water? Should I do a sponging? What medicines can I keep at the home to bring down the fever? So there are so many questions which come as soon as you know that yes, this is fever. So first of all, I'll tell you that what you can do at home to reduce the fever, how you look at that, when should I rush to the hospital, and then I talk about that what are the danger signs in your baby with fever that should immediately alert you. So the first thing is what you do at home. First of all, what you do at home is please loosen the clothes and keep him on a very, very light clothes. You cannot have lot of clothes and blankets around him and then you want that the fever comes down. You can keep a light blanket or maybe a light clothes. So that will be the first thing which will be there. Then I told you important thing. We have to make baby comfortable, as fever is not our enemy, but at the same time we should remember that we have to make our baby comfortable also. So we need to keep certain drugs that I will tell you. And the other thing, the commonest thing with the parents ask, should I put the baby in the ice water? Should I give them the ice bath? Ice bath, that is absolutely not required and one should not do, because sometimes this can cause severe decrease in the temperature and your baby may become cold, especially if he is infant. So the important thing is, even if you want to give a bath to your baby, if the child is having fever, please give him with the tap water, that is the lukewarm water which is available. So that is the halka gunguna pani. Usse you should give a bath. You should not give a bath with a very, very cold water. That should be implied. Is that fine? Then the other thing which is, there is the, should I sponge my baby or should I put compress on my baby? So there is difference between the cold compressions and the cold sponging. So once I tell cold compressions means that I wet a cloth and I just keep the baby on that and I compress it. Fine. And cold sponging means I wet my clothes and then I rub it off. I just don't rub it off on the chest. I rub it off on the hands. I rub it off on the limbs, and I also do it on the back. How does it help? So the help is, as soon as you put such kind of wet cloth, how do I wet a cloth? I wet a cloth again through a tap water. I'll never take a cold water. And then as soon as I put the water, the wet cloth, so there will be some release of the heat wave from that, and that will reduce the temperature. So important thing is, you should not do a cold compression, you should do a cold sponging. So again, I am telling you what does a sponging means. Sponging means as soon as I wet my clothes with the lukewarm water, I'll just rub it off. I'll not just put it and leave it for 2-3 minutes or maybe 30-50 seconds. I'll just not do that. Fine. We'll just wipe it. And remember that you have to do it on the back also. So that is one thing again which is very, very relevant to all of us. Other thing which a mother asks is commonly is that what medicine should I give, and are we allowed to give medicines at home? So you have some of the medications which are available over the counter. Over the counter means which you do not require a medical prescription for that. So you should keep a paracetamol syrup or a paracetamol drops. So how do a drops differ from a syrup? So the most important thing is that drops are used for babies under 6 months of age and they are highly concentrated. So what does a highly concentrated syrup mean or a drops means? So highly concentrated drops means that the concentration of drug, that means the drug which I am talking right now was paracetamol. 1 ml may contain 100 mg. So 1 ml 100 mg is a very highly concentrated thing. And if by mistake you give that concentrated drops to a child, you may cause a toxicity. So you should know a difference between a drops and a syrup. So under 6 months, we usually use a drop, and above 6 months, we usually use a syrup. Now again, syrup concentrations are different. So one should remember that what is content in what. So each 5 ml may contain sometimes 120 mg, each 5 ml may contain 250 mg. So one should be very cautious while using. It doesn't mean that last time we were given 5 ml, we'll give this time 5 ml without knowing that what is there, the content in it. So the important thing to remember is you have to use paracetamol at home by giving around 15 mg per kilogram of that drug that you are allowed to give, and once you give, you have to wait for at least 1 hour for that fever to come down. So you cannot become very anxious that, oh, I have given the drug and within 10 minutes, 15 minutes, baby is having fever which is increasing. So that is bound to happen. Drug will take at least 30 minutes or at least 45 minutes to act. So one of the important things, what I told you at home is, you lighten up the clothes, you remove very heavy blankets, you might give him a bath with a lukewarm water, you might sponge the baby, and other thing is you will give a drug. So other drugs which are available is ibuprofen and mefenamic acid, but I'll tell you that please don't use these drugs without a doctor's prescription, because you don't know that whether it should be used or not. It depends upon the doctor that whether he wants to give that drug to your baby or not. So for you at home, you may keep a simple paracetamol syrup, and maximum maybe as a first aid medicine, you should keep a syrup ibuprofen. So one thing which is very, very important in all these things is, you must remember that as a mother, now you ask me that are there any flavored things which are coming? So yes, there are flavored things which are coming, and baby may like it also. So what happens? In some of the rare instances, what we have noticed that because the bottle was looking so good and it was a colorful and it was very tasty, sometimes baby drink the whole bottles, fine, and that can be very devastating for your kid. So I'll just ask you to please keep the medications at least double the height of the baby, fine. So you should keep it at a very high up in your home. And the other thing which is very, very relevant is, maybe you can use the syrups which are having child lock. So there are now syrups which are available which cannot be easily opened by children. It requires some technique which may not be known by especially children who are between 1 to 4 years of age, because these are the children who are very, very naughty and they will just do whatever they like, and you may not be able to do much in that. Fine. So that is one thing which is very, very important. Please keep the medicines at a very safe place. So next it comes. So we have done first aid at home. Now the things which come are very, very relevant to us. That is fever harmful? Even whatever I have told that fever is very friendly, it is good to human body. Some of the parents come and ask that, is fever affecting the baby's brain? Is it affecting the baby's brain? If the high fever comes, my baby may have seizures. So what should I do? So remember, any fever which is above 105 Fahrenheit, it may be really bad for your kid, and sometimes it may affect your brain. Otherwise, if a fever is coming between 100.4 to maybe 103, 104, sometimes even 105, please be rest assured that mostly these kind of fevers will not immediately cause harm to the brain until and unless there are certain associated complaints which will be there. So what are those associated complaints? What are the red flag signs that makes a mother worry? That, oh, I should worry now, yes. Or should I immediately rush to the doctor? So the first and most important thing, please remember, any child who is under 3 months of age, any child who is under 3 months of age and has fever more than 100.4 Fahrenheit, it is one thing that is alarming. Why? Because usually these small kids have fever, they might have an underlying infection. And if that infection goes undetected in first 12 hours, 24 hours, maybe 48 hours, that can be very, very harmful for your baby. And sometimes they may even have a lot of complications, and even they might have to lose their life. So don't take any fever lightly in babies who are under 3 months of age. That will be the first thing which will be very, very important. So the other thing which is very, very relevant to thing is that what are the other complaints? So any child who has along with fever, like a lot of headache. Baby is looking very dull to you. Baby is looking very lethargic. As the behavior of the baby is not good, that means the child is quite irritable and the child has become quite fussy. That is one thing again which can be alarming. So if any change in behavior, increasing fussiness, increasing irritability, not the usual behavior, again that is one thing which may not be good for the child. So that remains for every age group. Across 1 month to 14 years, this will be a red flag sign. What are the other red flag signs? So any child who has a lot of cold hands and feet. So if your baby who is having fever usually will always have some cold hands and feet. But as the fever comes down, these hands and feet, they will become warm. If they don't become warm or they remain quite cold, you can feel, yes, my baby is very, feet are very cold, and even I am feeling that yes, my baby is not behaving appropriately, my baby is looking quite dull. Then these are the signs where you should immediately rush to the hospital because a lot of infections that may be very. So what will make me worry? Any child who has a fever with rash, especially in this season or even in any season, if a child has fever with rash, it is something which may be worried, especially in children who are under 1 year of age. If a baby has fever with rash, you should immediately go to the doctor and visit. There is no point waiting and giving some drugs and waiting. It is better to visit to a doctor and find out what is happening to your kid. So that will be again a very, very important thing. The other thing which I'll tell you is very, very important for us is the urine output. So always a doctor asks how much baby has passed urine. If you feel that with the fever, now baby has also reduced urine output, the baby is doing less amount of urine, then that is again a worrying sign. If a baby is having lot of pain abdomen, baby is not taking anything, baby is vomiting again and again, then again that becomes a worrying thing that yes, this is a danger sign and we should go to the doctor. So what I mean to say is, if I tell you that what are the red flag signs, so any baby under 3 months of age having fever, that is which we define by more than 100.4 Fahrenheit, then we should immediately visit the doctor. Any baby who has fever with rash, lot of headache, fussiness, irritability, not looking good as usual, even after the fever has come down, baby is quite dull, lethargic. Sometimes baby may have abnormal movements, that is called as seizures. Your baby may have some eye uprolling, some frothing from the mouth. So those are the signs, some movements of the limbs. So these are the signs that maybe there is a brain infection which is happening with the fever. So these are some of the signs where you might have to immediately rush to the hospital or the nearest emergency, and there further things can be decided. So these are some of the things which are very, very important and relevant to us. And now what I will tell you is that there are frequently asked questions which are there in the mother's mind, and they will always ask me in the outpatient or even in the. So the other thing which is very relevant now is that how high a fever is and should I go to emergency? First thing always people ask. So there is no defined number as such, but any baby who has fever more than 103 should take a medicine to comfort itself and rush to a nearest hospital or maybe a OPD to see a doctor. At times, sometimes in night, you are not able to go, but if you find any danger signs, you look at those danger signs and maybe you need to visit the doctor in the night only, or sometimes you may calm the baby if he is fine, otherwise in the night you may have to go in the morning and show. So the number which is defined is 103 and above, and again I am telling you, any infant with fever and not looking good, you don't have to look at the only number, you have to look at other problems which are associated, and maybe that is the time you should go. So what defined high fever is, in children under 1 year, we tell it is 101 and above, and in children above 5 years, it is 103 and above. So in between those digits, you might have to look at certain between 101 to 103. So that is one thing. Now I'll just tell you about the number of questions which come to the parents' mind. One thing is, if my baby is suppose sleeping. What should I do? Should I wake up the child and give the medicines? So the one thing is that in a child who is sleeping, it is better first to wake them up and then you can give a medicine, because it may not be a great ploy to wake up to give the medicine while the baby is sleeping, because sometimes that may go into the air passage and it might cause lot of difficulty to these kind of children. So one thing is, yes, you should give the medicine if the fever is very high, 103 and above. You wake up the baby and then you try to give the medicine. You don't give the medicine while the baby is sleeping. So that is one of the thing. So other thing is, I have given the syrup or the drug to the baby and now the baby has vomited. What should I do? So yes, that is very common, because in fever, the increasing tendency of vomiting. There is a lot of tendency to vomit drugs once you have a fever. So what we advise is, if the baby vomits within 20 to 30 minutes of giving a drug or immediately, you may repeat a dose. Fine. So if a baby vomits immediately or after 20 to 30 minutes, you might repeat the dose of the same medicine. The other thing is, sir, I have given the medicine. Now, how long should I wait? How frequently should I monitor my baby's fever? So the thing is, once you have given a medicine, any medicine will take at least 30 minutes to 45 minutes to act. So please be calm and remember that once you have given a medicine, it will take certain time, and even after 30 to 45 minutes, the temperature may only come down by 1 to 3 Fahrenheit. That means if my baby was having fever of 104, if you measure after 1 hour, it may be like 102. So you will tell, sir, there is no response. Fever is not going. What should I do? No, the response has come. Fine. You want that it becomes normal, it will take some time. So please don't be anxious during that time. Wait for the drug to act. Now the other scenario comes, I have given medicine and even after 1 hour, sometimes my baby's now fever is increasing. What should I do? I have given it 103, now I am monitoring and it has become 104 after 1 hour. What should I do? So that is very relevant. So then the things which I have told you are very, very helpful. You lighten the clothes of the baby. You may use a lukewarm water to give a bath. Sometimes you may do a sponging. So that is very, very helpful. And sometimes if all this also not works out, then you might have to take another medication for fever, which can be prescribed with the help of your doctor, which you are personally looking, or maybe a call on the phone. But it is better once the fever is above 103 to show him once within 4 to 6 hours of all this problem. So then again it becomes relevant. And the other thing which the commonly asked question is, my baby doesn't eat anything in fever. What should I do? He will become very weak. What will happen? What do I need to do, doctor? Something has to be done. Please admit him. So in babies having fever, you should remember, they will not have much of appetite. They will not eat much of the things. You as a parents have to maintain his hydration. What do you mean by hydration? You need to give lot of liquids to your kid. One thing which is helpful is, as you give liquid to the kid, one thing is that in fever, lot of water is lost externally as the babies are breathing very fast. So the thing which will come is that you have to give more water. Another thing is that viral clearance sometimes increases as you give more water. So that will be very, very helpful. So no baby once who is sick may eat as normally as he was previously. So you have to give a lot of water, and maybe sometimes small frequent trying of small meals at home, and that may be relevant. Otherwise, most of these babies will be on liquid diet for day 2 to 3 days, because normally you expect any fever to go by around day 3 to day 5 even on treatment. So you don't expect that your baby will improve immediately even after giving some treatment. So that will become very relevant to all of you. Now the next question which commonly comes is that my baby usually develops fever after vaccinations. What should I do? So most of the doctors will give you the drugs that will help you while you vaccinate your children. So don't worry, it is bound to happen, because some of the components are there in the vaccine that it is getting absorbed. So that is a good sign, and it is going to happen. Some of the vaccinations do cause fever, and at that time again your aim is to make the child comfortable. So most of these are doctors will prescribe you maybe a paracetamol or sometimes a ibuprofen for having such kind of fever, which will be there. The other thing which comes is that the thing which is there is, where will you recommend putting these cold fermentation on the baby? So I have already explained that once you do a cold sponging, it has to be done on the all body. That means you have to do it on the face, you have to do it on the hands, you have to do it on the back, you have to do it on the abdomen, and you have to do it on the limbs. So you are just moving around, you are not keeping it. Fine, that is one of the things which is again very relevant. So the other things which is comes is that should I give home-based ORS or should I give glucose to my baby who is not having anything? So yes, we do allow them to have lot of maybe lemon waters, coconut water, and maybe sometimes even fruit juices which are made at home and which can keep them hydrated and keep them going, because they are at very high risk of losing lot of amount of water, and even you as a parent will be worrying that what should be done. Another thing, that as the child starts to recover from this fever, that what we advise is you usually add one meal extra, so that whatever has happened in the fever will, because it is a draining for the body. So what we advise is you add an extra meal once they are recovering. So how much to give? You add one extra meal for at least 2 to 3 weeks after your baby has recovered. That will help him regain whatever he has lost during that fever. So other thing comes is, what are the common causes of fever and how should I worry? My baby gets fever every month. What should I do, doctor? He is having lot of immune problems. My baby is not doing well. Please look into this. So one thing I'll tell you is, in Indian setting, most of the babies will have fevers in between age group 6 months to 5 years by around 4 to 5 episodes. It is very common to get fever episodes around every maybe 1.5 to 2 months. Because why do they happen? Because there are so many lot of viruses which are happening, which are across there. Now these babies, you visit the daycare, you send them to schools. Some of them may be recovering, some of them may not have a good health or a hand hygiene. Now they are picking their noses, they are coughing, and they have put their hands on the tables. Your baby is going, playing with them. So these are the things where you might have fever. So it is very common for a baby to have fevers around 4 to 5 times in a year. So what does it alarm me? If it will alarm me, once it is requiring recurrent hospital admission. If your baby every time with the fever is not well, requiring hospital admission, maybe sometimes he is developing pneumonia, the baby is developing breathing difficulties, and baby is not growing well, baby is having lot of rashes, baby is losing weight, then these are the children who especially require some other opinion or maybe a expert opinion for finding out why it is happening. It is not common for children to have other signs of what I told you with fever. Fine. So if the baby is having such kind of symptoms, it is better to go to a specialist and meet it and then tell. Other thing which commonly comes is that last time the parents came to me, I prescribed them some medicines and they took it. And next time the baby develops fever, on day 1, maybe mother is not able to contact me, or maybe she is not liking me much and they don't come to me on day 1. And then on day 2, she calls and tells that the fever is not improving with your medications. Then I'll ask, when was the medication last given? When I have seen you? They'll tell, no, last time you prescribed the medicines, I have used the same medicines and you gave that antibiotic. I started with the antibiotic. Now my child is not improving with that. So remember, please do not use any prescription which was given previously. Every time the cause of the fever may be different. Sometimes it may be viral, sometimes it may be bacterial. It is for a doctor to decide whether it is a viral fever or a bacterial fever. Is investigations needed in this or not? So please do not take yourself any over-the-counter medication like antibiotic and you start giving it. That will be a very bad sign, because sometimes we keep on giving antibiotics and we develop lot of resistance. What you mean by resistance is you might carry organisms which are difficult to get treated with the antibiotics. So remember that every fever does not require antibiotic. Sometimes it may just require a paracetamol, lot of fluids, and just bed rest. Fine. Most of these viral fevers will improve by around day 3 to day 5 with this treatment only. So that is one of the things which we know. And anything, if you have any question, we are free to really help you. And because we are looking in all these things, one thing I'll tell you is we work in Zydus Hospital. We have a 24/7 emergency here for pediatrics, and there are a lot of expert doctors which are available for pulmonary practices and even for neurology. So you have a very composite emergency which is here in the Zydus, and it is open 24/7. So if you have any of these queries, you are free to call or maybe visit emergency if your child is sick. Thank you all.